Hello, in today's lesson, we are going to be going over the questions and answers for the Mammography Registry review. This is for the projections, views, and positionings that are done in mammography. The questions will be questions 1 through 15, but if you want more questions for this section, could you let me know in the comment box or give the video a thumbs up? And then this is the mammography content specification. I always just like to put this in the video because some people may see this video for the first time and haven't seen my other Q&A videos. So I always just like to add this in kind of like as a reminder. There will be 115 questions on the Mammo registry, but this is with ARRT. If you're not doing your boards through ARRT, you can still use this review questions and answers because it's like nationally, you can prepare for it for a national board pretty much. So for this particular section, if you look where the red arrow is pointing at, there's going to be about 39 questions geared to the positioning and procedures topic under the procedures and anatomy section. So that's going to be a large part of the exam is the procedures. So it will be about 115 questions, but you are going to have those 30 unscored questions that you still need to know just in case those are counted or not. So we'll Okay, for the Q&A portion of my videos, I like to read the questions and the answers and give you just a moment to think about what the answer could be, and then I give you the answer. And I just do this because a lot of people, some people can't sit in front of the computer or watch their screen, especially if they are driving or at work. I've had people tell me they listen to my videos while they're cleaning, driving. So that's why I just like to just read everything out just in case someone cannot actually look at the computer. For question 1, the automatic compression should never exceed 15 pounds, 25 pounds, 30 pounds, or 45 pounds. The correct answer is 45 pounds. So if I'm going too fast, just rewind or pause the video. But for the explanation, automatic compression should never exceed 45 pounds of the initial compression pressure. For question 2, pectus excavatum is the medical term used to describe a patient with breast implants, humpback or kyphotic, protruding sternum, or sunken chest. Sunken chest is the correct answer. Pectus excavatum is the medical term that is used to describe a patient that has a breastbone that sinks into their chest. So, of course, this is not a woman body right here, but you kind of get the idea of how a sunken chest will look. So, this is the same for women patients, except they will have, breast tissue. But I've seen their chest sunken in like this. For these type of patients, I've had to increase the angle of the tube to about 50 to 55 degrees, just depending on their body habitus. Sometimes they do not automatically fit in the 45-degree angle tube that most techs will rotate the machine. You may miss some breast tissue in the posterior aspect of the breast on your MLOs if you do try this, but just do the best that you can, but also document the reason why there was like a limited study. You can say limited study, patient has pectus excavatum. If you don't know how to spell out that word, Google it or just put sunken chest. But it does look better if you're typing the actual medical word in, to the radiologist. You kind of look like you know what you're talking about. So I'll just leave that up to you, but just make sure that you do put notes in of the reason why you couldn't get the proper images. Question 3. Which projection demonstrates the extreme posterior and upper outer quadrant of the breast? Is it the cleavage view, craniocaudal, exaggerated craniocaudal lateral view, mediolateral oblique? Mediolateral oblique is the correct answer. The MLO view demonstrates the upper outer quadrant and the extreme posterior portion of the breast. The craniocaudal or CC view is best for the anterior, medial, central, and posterior medial portions of the breast. The exaggerated craniocaudal lateral view is used to better visualize the lateral proportion of the breast, especially whenever you are not able to get all of the breast tissue on your CC view, or you have like disc tissue on your CC view that you need to get more of, or if you see some type of pathology, it's good to do that XCCL picture. I know it's like an additional picture. You only want to stick to your four pictures, but if something was seen like microcalcifications and you didn't get it, you may be liable or you may get in trouble. Not saying that you will get sued, but you just never know. You may or may not if that was missed. Question 4. Which projection best demonstrates the central, anterior, and medial aspects of the breast? Is it cleavage view, craniocaudal view, exaggerated craniocaudal lateral, or your XCCL, medial lateral oblique, or your MLO? That's going to be your craniocaudal or CC view. That's the correct answer. And just similar to like the last slide, the craniocaudal view or CC view is best for the anterior, medial, central, and posterior medial portions of the breast. The medial lateral oblique or MLO view demonstrates the upper outer quadrant and the extreme posterior portion of the breast. Your exaggerated craniocaudal lateral view is better used to visualize the lateral outer portion of the breast whenever you have not gotten enough breast tissue on your CC view. Like for this picture, I would do an XCCL view. This is a good CC view, but just for me, because I don't want any patients being called back and it's like a lot of dense tissue right there, I would just go ahead and do like an XCCL view. Since this breast tissue is dense, very dense, I would have it in like a 3D. You know how you do the combo HD? That's what I would do this in. I wouldn't do it in a standard 2D picture. Question 5. The craniocaudal CC view is poor at visualizing the anterior portions of the breast, the central portions of the breast, the medial portions of the breast, the posterior portions of the breast. The posterior portions of the breast. The CC view is poor at visualizing the posterior and posterior lateral aspects of the breast, but it is best at visualizing the anterior, medial, central, and posterior medial portions of the breast. For question 6, which tube angle should the mammography detector be rotated for the medial lateral or MLO projection? 10 to 15 degrees, 15 to 20 degrees, 30 to 60 degrees, or 45 to 70 degrees. 30 to 60 degrees. The mammography detector should be rotated 30 to 60 degrees for most patients, although most techs may automatically rotate the machine to 45 degrees for each patient. It is important to know that you cannot force a patient's body into a 45-degree tube angle. 50 to 55 degrees is best for slender built patients, and 40 to 45 degrees is best for patients that has a large body habitus. I have not had to I have not had to do this yet, but I haven't had to rotate the machine to 60 degrees for anyone, even male patients. I've been able to get away with 45 degrees for most male patients. Sometimes I may even have to go up to 50 or 55 degrees, but just play with the degrees. Just don't get in the habit of just saying, they trained me to do 45 degrees and that's all you do, because that's really not being a good tech. You have to think outside of the box. Question 7. All of the following should be included on the patient's mammogram image except for the patient's name, the patient's medical record number or their MRN number, the patient's social security number, the technologist's name. The answer is the patient's social security number. This should not be included on the mammogram image, but the name of the patient, the mammography projection, such as your CC view, MLO, XCCL view, the technologist's name, and the mammography unit number, like the room number and the machine number. All of this should be included on the mammogram image. The facility's name, date of the exam, and time should be included on there as well. I see my name at the bottom, kind of like my full name. I believe I see that. And I always see my initials on that image. And then you see which breast that you're doing, whether it's R for right, L for left, like you see those, like those acronyms as well. The patient's social security number will not and should not be on the mammogram image. For question 8, where should the mammography technologist stand while imaging the patient for the craniocaudal CC view? Is it behind the patient, directly in front of the patient, the lateral side of the patient, or the medial side of the patient? The correct answer is the medial side of the patient. The tech should be standing on the medial side of the patient because this is going to help you pull in that medial and central aspect of the breast. That's what the CC view is for. The CC view is very important for imaging the medial and central aspects of the breast. For question 9, the mammogram image is taken during inspiration, on suspended respiration, when the patient is holding extremely still, when the patient is breathing. The correct answer is on suspended respiration. So the patient will be told to hold still. So it is true that the image should be taken while the patient is holding still. But however, the point of the question is the image should be taken when the patient has stopped breathing. So you shouldn't be taking the picture while the patient is actively holding their breath, because you will see motion on the image. So ideally you are taking the pictures whenever they're not breathing. That's what suspended respiration is. Question 10. Which direction does medial lesions move in comparison to the MLO and ML view? Medial lesions does not change. Medial lesions move down. Medial lesions move up, or medial lesions move to the side. Medial lesions move up. So medial lesions move up when comparing this to the MLO and ML view. Lateral lesions move down. Central lesions will not change. Question 11. Which direction does lateral lesions move in comparison to the MLO view? Lateral lesions does not change. Lateral lesions move down. Lateral lesions move up. Lateral lesions move to the side. Lateral lesions move down. So they move down when comparing this to the MLO view. Medial lesions will move up. Central lesions will not change. So before I forget, because I forgot and I'm glad I thought about it, so let me just throw that in here right now. If you all could let me know in the comment box when you are taking your test. I've had like different comments that come in or came in where people had told me when they are taking their test. So I try to make sure that I'm adding more videos like this before they do take their test. Like I had someone recently comment and say that they was taking their test this upcoming Monday. So that's why I'm making this video now to try to get more information out for them to know before Monday. Question 12. Which projection is best to image a lesion that is located in the medial aspect of the breast or located high on the chest wall? Is it the from below position, craniocaudal CC position, exaggerated craniocaudal lateral or your XCCL view, your lateral medial or LM view? The lateral medial view. So this view is best for visualizing and improving the detail of lesions that are located in the medial aspect of the breast or high aspect on the chest wall. Question 13, we're almost done. Which projection is best for locating lesions that is seen on the posterior lateral aspect of the breast and not seen on the craniocaudal CC projection? Is it the from below position, craniocaudal position, exaggerated craniocaudal lateral view, your lateral medial view? Exaggerated craniocaudal lateral or XCCL view. So, like I was telling you, if you see like any dense tissue or if you have looked at the prior images and you see that you have not gotten all the way like the lateral side of the breast like they did the prior year, go ahead and do that XCCL view because you may miss something, and depending on the radiologist, they may just have the patient come back. So just go ahead and take the pictures while the patient is there. I know some patients, may not want another picture taken, but just explain to them you're just doing it so that they don't get called back. Question 14. Which projection is best for imaging patients with small breasts or kyphotic patients? Craniocaudal CC view, exaggerated craniocaudal lateral XCCL view, the from below view, or lateral medial view? From below view. This view is best for imaging patients with small breasts or kyphotic patients. Lesions in the upper outer quadrants or the superior portions of the breast can be visualized with this projection too. All right, this is the last question, question 15. Which projection is best for imaging lesions that is deep in the posterior medial aspect of the breast? Cleavage view, craniocaudal view, exaggerated craniocaudal lateral view, or the from below view? The correct answer is the cleavage view. The cleavage view is great for imaging the posterior medial aspect of the breast. For this view, both breasts are imaged, and you will have that it obtains an image that is closest to the chest wall. So this is an image of the cleavage view, and the round circles on the picture, you can see that's a mole marker, and this is like a good cleavage view. You can see the medial aspect of both breasts. Okay, so that's it for the questions. If you could please just leave me a comment, just let me know which videos that you would like to see to help you prepare for your registry. I do have a mammography registry review playlist. Click on that playlist because I have a lot of videos that will help you pass your test on the first try. I even have like 3 videos where the lesson is like an hour long, so that's like very detailed and packed with a lot of knowledge for you. So just leave a comment below. Also, let me know when you are planning to take your registry. And I appreciate you all for watching my videos. If you found it to be helpful and would like more of these, could you please either leave a comment or give the video a thumbs up? Shout out to these ladies for passing their mammo registry recently, and then depending on, this was probably like 3 weeks or a month ago. But of course, if this video is 8 months old, this gonna be like the time frame is gonna be a little bit off, but this was recently. This was probably in, I will say, probably May of 2025 and June of 2025. They left me a comment on my video and they told me, they came back and let me know that they did pass their registry. So from what these ladies did, because I think I remember seeing them comment on other videos. I think they viewed all of the videos in my playlist that I had up until the point of them taking their registry. And I believe that they watched the full hour-long lessons as well. So, um, like the lady at the bottom, Amanda, this is not a Q&A video that she reviewed. This was like a lesson video that she watched and commented on. And then also you have Argelia at the top. She reviewed all of my videos and she took the time to comment on one of the Q&A videos. So anyway, people are using my videos and they are passing. So just go to the playlist. Just go through the playlist. You can just click on the playlist and let the videos play in order. But other than that, thank y'all for watching. Hit the subscribe button if you want to see more videos and just to stay up to date on the videos that I have. And other than that, thank y'all for watching. See you all in the next video. Just let me know in the comment box. Bye.